So at Start, we understand addiction to be a multi-dimensional, multifaceted problem. Our main focus really is what can you do about it, and here is a pathway out of that problem. So our treatment approach really is what's called Minnesota model. Minnesota model treatment understands addiction to be a chronic relapsing illness with biological, psychological, emotional, spiritual elements to it. And so we try and address our clients holistically in all these areas. The foundation of Minnesota model treatment is abstinence from not just the drug of choice, which could be, let's say, cocaine, but globally. It's trying to treat the whole person, mentally, spiritually, emotionally, and it's very community-based. So Minnesota model treatment at its heart is about the understanding that the isolation and loneliness of addiction can be, in fact, the way I'd put it would be, in addiction, one has a relationship with a substance. Minnesota model treatment is trying to replace that relationship with the substance with a relationship with other people, with oneself. So we believe that can happen within the context of a therapeutic community. It's about connection, and it's very much about our clients getting the 12-step fellowships. Alcoholics Anonymous, Narcotics Anonymous, and all the other 12-step fellowships. And actually here at Start, we're ideally placed for that because we're in South Kensington, and many of these fellowships were founded in West London. So within a 10-minute walk of Stop's clinic and of our residential houses, there are dozens and dozens and dozens of meetings. So it's really possible for our clients to really get into recovery as a lived culture, as a lifestyle, because it's just so convenient. It's all on the doorstep.
When you're in a recovery community, the community get to challenge each other. The community get to work through problems and issues with each other, which are really just a microcosm of the kind of things that you have to deal with out in the rest of the world.
The Minnesota model is the most mainstream treatment methodology there is in the world. And probably the reason it's the most mainstream addiction treatment methodology is because it is effective. There's a lot of evidence for that effectiveness. I mean, most recently in 2020, the Cochrane Institute, who specialise in producing absolutely gold standard medical research, they investigated addiction treatment, and the question that they looked at in the Cochrane Institute was, what's the most effective modality for treating addiction? And they compared motivational interviewing, cognitive behavioural therapy, CBT, and what we do, 12-step facilitation, or effectively Minnesota model treatment. And they looked at 10,500 people, which is that's a massive study size, who'd been through these three programs. And the finding was actually that the 12-step facilitation or Minnesota model treatment had a 42% success rate compared to CBT, which I think was 35%.
The identification between, two people that suffer with addiction is one of the things that heals the shame. The empathy that happens there is really where the magic happened.
The final picture of addiction normally, and yes, there are always exceptions, but normally is one person on their own in a room using. And that's what life shrinks down to. One person, one chair, one table. That's it.
Addiction is very much about isolation and disconnection, and about shame, and about the darkness, really, that comes from all of that, the depression that it brings about, the emptiness, the despair. And 12-step recovery really changes all of that. It brings about connection, it brings about healing from shame, it brings about freedom, and it brings people into the light.